Welcome to It Takes Heart. I'm Kate.
And I'm Sam, and we can't wait to share more incredible stories of healthcare professionals making an impact across Australia.
We talk about, going into rural healthcare, but again, if you don't see what it actually looks like, saying something at a university lecture on a piece of paper is very different to actually seeing what it looks like. There's never really been a better time to be a pharmacist because there's so much changing. That's the best time to get in there and build a career for yourself and do whatever you want to do. And I am excited about the future of pharmacies.
We care for the land and sea.
We acknowledge the traditional custodians of the land of which we meet, who for centuries have shared ancient methods of healing and cared for their communities. We pay our respects to elders past and present.
Today we are chatting with Shaylee Mills, better known on social media as the Rural Pharmacist. Shay is a passionate advocate for rural life and the incredible role that pharmacists play in these communities. On her Instagram and TikTok accounts, you will find so many great stories, insights and tips about life and work as a rural pharmacist. I can't wait to hear more about that. Even just the quality of what you put together is incredible.
Thank you.
Shay is the ultimate advocate for rural pharmacists and has no doubt inspired thousands to consider these unique opportunities. Today, she has travelled across the country from Karratha in the Pilbara region to Brisbane in Queensland to be with us today. Thank you so much, Shay, for joining us.
No, thank you so much for having me here. I am super excited, and it is nice to get out of Karratha every now and again. So this is awesome.
Every now and then at the big story, and then we've got you in this tiny room out of Karratha.
Yeah, it's all right.
Big white spaces.
Straight off as long as it's not the red dirt, I'm fine.
Fair.
Yeah.
Well, do you know what? We connected a little while ago and I came across your profile account.
What do you call it? Is it an account?
Is it an account?
The Rural Pharmacist?
Like my Instagram page or
Yes.
account.
Page.
We had this conversation
It's like a profile account. Anyway. So we connected and I was just really taken by what you were doing. I thought it really, I really loved the content. You were really showing variety of work and real joy in what you do. There's a real sense of positivity and a real passion for the industry, but also that rural community work. So really inspired
beauty
today.
Of the rural areas too. Like
Definitely.
just stunning.
Definitely.
Yeah.
And I haven't seen high vis. People might think of Karratha and mining town, things like that, but it was really beautiful.
So true.
Really beautiful, your posts. I guess what inspired you to start on socials and sharing this pharmacy related content?
Yeah, great question. It sort of happened in a very roundabout way. Took me a little while really to get there. I think it was an idea that sort of been building up over time, and I just didn't really realise that it was an idea in itself. But like you said, I'm particularly passionate about being a pharmacist. I really enjoy my job and I love working in rural pharmacy. And I think that's quite special because there's plenty of people in the pharmacy industry that don't particularly like working, or they're not as excited about it anymore, or there's a bit of negativity in our industry, which is understandable, and I think that goes across the board for the healthcare sector. But I think it's really special that at least that right now I've got a lot of energy about it. And so I honestly remember my first day working in my first rural job. I was an intern pharmacist, so I wasn't fully qualified.
And where was that?
I just moved to Broome, so it was a rotation across the Kimberley, but the main site was in Broome. And I'd moved away from home. I have moved away from home a couple of times doing boarding school and stuff, but once I'd got there, I was a little bit homesick and I was like, oh, is this the right decision? What have I done? I'm feeling a bit nervous, I'm a little bit unsure. Went to my first day, took me an hour, and I was like, this is it. I've made the right decision. I'm totally fine. This is exactly what I needed to do.
What was it?
And it just took off from there.
What was it that really made you realise that?
I think it was just the people that you work with. They're so welcoming. They're very calm. It's all casual. We're just there to help people. And then the people coming in, it's the same thing. They want to have a chat with you. They want to get to know you. They want to know who the new person is. I think it's that welcoming part of the community that really makes you feel like you're basically this is your new home. And I absolutely love that. I love talking to patients. I could honestly
were you in the Broome hospital at that point? Or?
No, it was actually in a community pharmacy.
Yes, right.
So it's a community-based job. It was very aligned with working together with the Aboriginal Health Services there. So as I said, the main base was Broome, but I also got a chance to go out to Fitzroy Crossing. There was a site out in Derby, which I didn't get to go to, but yeah, it was very rotational and very exciting, very different, something that never really was mentioned at university. So when I got there, it was very eye-opening, and I was like, this is actually great. Like, I get to travel around.
And how did you get to that point? Because if you're leaving university, and it was a lot of hospital-based discussions, or what was the
placement?
What was the mainstream that you expected?
So when you start pharmacy, pretty much you always start in community pharmacy. That's the easiest sort of entry gateway to get into. And community pharmacy, I guess, like, there's so many of them around. We always need access to medicines, so there's always work. And then as you sort of go through the different years, it'll be hospital sort of like a next step up. Like, once you get a good basis of what you do in community pharmacy, then you go into hospital, because that can just be a little bit more complex in terms of maybe the patients that you see, or the medicines or the wards that they specialise in. So you do get a variety throughout university, but basically, most people would do placements in community, you'd work in community pharmacy, and then, like myself, I then got a job in hospital pharmacy afterwards, based off the fact that I had experience in community pharmacy, and did hospital placements as well. I also took rural placements too, because I was like, if the university that I went to funds rural placements, so I took that opportunity to go somewhere, and that's actually where I found Karratha, and my love for Karratha there.
Can I just ask you, when you're talking about community pharmacy, is that working in the Priceline pharmacy, or is that working for a community service? Or both?
Yeah, good question, actually. So for the most part, it's sort of the pharmacies that you would walk into
in retail,
wherever you go. So also known as retail pharmacy.
Right.
I do try to keep it towards community pharmacy, because all the pharmacies that I've worked in, it's definitely been, and I think there's a big shift in pharmacy where it's more about the service that you can provide, and the information that you can give, rather than just selling the medicines with a label on the box.
Is that too because ultimately you're in a retail space? So if I can choose to go to this pharmacy or that pharmacy, I'm going to want to go to one with a customer service lens.
It's very wishy-washy.
And is there that retail component?
They can be, and
historically, get you those glasses at the counter as well, which I feel like
they've got the little bins of
KPIs, but KPIs and
do you have KPIs?
Depends on the pharmacy that you work for, and I guess there's different franchises as well. They all have different ways that they like to go about it. Each pharmacy is still then individually owned by a pharmacist, who then might go into a particular franchise. So again, then it's also up to them, how that sort of goes. But it's sort of, you've got one end where, maybe it's particularly retail, and then you've got the other end, which is quite service-based. So the main thing that they're sort of providing is maybe more health checks or medicine reviews or something like that. That's their primary focus. But it's all interlinked and intertwined.
And what about, you mentioned earlier about the negativity in your industry. Just while you're talking about that, what is the negativity?
Yes. Again, another very good question.
Thank you. I've clearly done quite a bit of research.
You've done excellent research
today. Actually, no.
Not even written down.
None of these are written. None of these. I was just what's the negativity? What's happening out there?
But these are really good questions, because it's so natural for me when I say it and I think about it, and it's I've got that pharmacist brain. I know what every other pharmacist is thinking of, but for you guys, it's a context that you probably don't understand.
I think if you just talk to the general public, if you think pharmacy, you think, I go in there, I get my script, the doctor sent me there.
Yeah.
I just go to wherever's closest or to wherever I know. But there's a lot of complexities to the role. So I'd love to, when we ask obvious questions, it's sort of thinking with people with very little knowledge.
No, that's excellent. That's great. In terms of the negativity, it's particularly in community pharmacy, it is a job that there is high demand, it's very high pressure, there can be big working hours.
I suppose because you're working shifts as well.
Yeah, working big shifts.
Weekends.
Yep, weekends. And then workforce shortages, again, perpetuate that. So depending on, I guess, what where it is, where the location or the workplace culture and things like that. That can definitely weigh you down. It happens across the board, as I said, in healthcare sectors. Like, just the burnout rates are quite significant with what we're sort of having to deal with day to day, I guess, in terms of, what the pressure that's placed on us, what's expected of us versus what we can actually do. Like, we can do so much, but then sometimes the expectation of what we can do is what we actually can't do, and this is what we can offer, and it doesn't always align between different health services, and that can be really tricky to navigate when you've got people with a certain expectation of what they want, and it can't go that way for different reasons, like legal reasons or ethical reasons or whatever, what's even available, how many staff you've got on.
I was just going to say, because it's a retail store too, so if there's not enough staff but someone needs to work, that's where that burnout would come in, and particularly in remote communities where you'd feel that need to have to keep turning up and
the service levels are that's something that's really important to you.
Yes, for sure.
How do you look after you?
How do we look after you? Yes. In my case, I definitely just try to find areas throughout the day or areas throughout the week where I'm like, that's going to be just my time to switch off, or, I guess have my own little bubble. Pharmacy is a very social job, especially in community pharmacy. You're talking to people all day. That can be quite draining.
And you get repeat clients too as well, which would be nice, but then it could be draining as well.
Yeah, repeat clients or just new clients, or, sometimes where maybe the situation is quite hefty, high pressure situation, you're making some pretty big decisions that can impact people's health very significantly and very quickly if it goes wrong. So that's hard to handle as well.
Can you maybe give some examples of that? Talk us through scenarios where
it could go wrong. You're saying, and the challenges.
Yeah, well, it can be anything from as little as like something that's been prescribed, or even a better situation is like something that a patient might want because they've seen it or they've looked up their symptoms, or they're thinking that that's what they need. Dr. Google. We love a good Dr. Google.
You thought that? I thought it was Empic.
Yeah, and then again, like that's sort of what they're wanting or hoping or expecting, and you can't, you're sort of sussing it out, but you have to ask a lot of questions to get there and get that information. Like, how is it that they've got to this conclusion? Is this what we actually need to be treating? Like, you're constantly sort of creeping in information.
And this is just for that over-the-counter.
Over-the-counter, it can also be like if they've come in asking if there's a particular medicine that they can have that if they need to see the doctor for, they'll go see it.
Right.
But, you're trying to suss out that information, and then you're sort of assessing like, well, with everything else that's going on for them, is this actually appropriate? Is this safe? Things like what if they don't have a script because it's run out, it's expired, whatever situation that they find themselves in. If legally, I'm not supposed to give anything out without a prescription. There's obviously a few ways around it, but if you're in a real...
There
Asking for a friend.
Yeah, there is. It depends on the medicine. It depends on what it's for and the situation. There are a few medicines that can go under what we call continued supply.
Right.
So if you're on it long term, it's for a chronic condition,
right,
and it needs to be taken continually. Then you can get a supply without a script as long as you have a history with that pharmacy and they can see that that's exactly what's been...
So me just being the mum that loses the scripts.
Yeah,
it's not good enough.
Yeah, yeah, you wouldn't just be able to rock up to any random...
Just clarifying.
Yeah. But yeah, like if you have to decide if a patient goes with or without that medicine, that's a really tricky situation to be in.
That's interesting because people might think that the onus lies with the doctor or the prescribing
practitioner.
As opposed to the and maybe just assume that you can't do any of those things, but it's actually a large, hugely weighted position that you're in.
And that's where it gets really tricky. So it's thinking about the consequences of what will happen if you do or if you don't. What are the reasons why I can and I can't? Maybe you're just looking at something where you don't have a full medication history and they've been prescribed something that's has known to have really big, large side effects, and you're sort of looking at it as always the red flags, and you're trying to suss out like something's not quite right here. I even had an instance the other day where it was it was insulin for a dog. And we don't know much about veterinary medicine.
Fair enough.
There was just, it's definitely out of our
Sorry,
scope.
my first question was about to go, do you guys do that?
Yeah.
Didn't
so
do
we
my
get
research
vet
on that.
scripts.
Do you?
Yes. Yeah.
Oh.
So even like,
Just because you're in a smaller location, or is that like no matter?
No,
that's not just a
across the board.
Karratha thing. That's like
there's across the board in pharmacy.
Right.
Yeah, we can receive scripts, like veterinary scripts, so scripts for animals. We can supply it. We don't get any information really about what it does or how it works or whether it's safe or not and what the doses are for animals. So that's pretty much all on the vet. But yeah, it was a situation where they'd getting an insulin, they'd received one previously, and sort of talking with them, I was figuring out like the insulin that they've been using is not the same strength, but they've been told to administer the same. I think they might be administering the same volume, which means that they're now getting 3 times the dose. So you're giving it to this dog, stuff like that where you're like, something's not quite right here, but I don't know if I am right. I don't know if I'm overthinking it. And it's again like poking and prodding. It's just those situations where you go, whew.
So there must be times when a patient brings in a script and it's been prescribed by the health practitioner, but you question whether it's correct.
Yeah.
And everybody makes errors.
Yeah.
What do you do?
Yeah. Look, I am so very fortunate that, and I think this is the case in rural healthcare in general, you have really good relationships with all of the other health practitioners around because you're constantly leaning on each other. You're asking for favours, you're getting to know them, you're having to call them all the time, so you get to know their voice. And then again, you see them around town as well, so you see them in a social setting. So for the most part, I can pretty much call anybody that I need to call and say like, hey, what do you think of this, or like just confirming this. It's never, because it's never like accusatory or anything like that. No, I never think of it as like they've messed up or whatever. Like there's so much that could be happening in a consult at once, and you're thinking of so many things as a health professional in general. So one tiny thing that has been missed, or maybe the patient didn't even tell and then they've come in and told me, changes the situation entirely. So very lucky that you can pretty much just call up being like, this is what I found out, these are the options that we have, what would you like to do, or what do you recommend, or what's your opinion on this?
Worst case, you can always just say, I couldn't read your handwriting.
I
just couldn't read it. What do you love then about being a rural pharmacist? Like, what does a typical day look like?
Yeah, I'd love to know a typical day, because I imagine you're not in the clinic all day long.
Yep.
And what else is involved?
Yeah, so I guess that's what I love about rural pharmacy, is that my typical day looks different every day. You get to have multiple job roles because there's less people. So you, instead of having one person for each individual role, you kind of have to fill all of them. So for the most part, my basis is in the community pharmacy, so where any patient can walk in with their prescription. And I just love the fact that, it's a local town. There's lots of local people. Karratha is quite large. It's like 21,000 people. So I get to see my patients over and over and over and over again. So now that I've been there for 2.5 years, like for most of the patients that come in, I'll have seen before, or I know them by name, and I know exactly what's happening, and that's really nice to have that. You don't get that a lot in pharmacy, in Metro particularly, just because it is so transient and people can go anywhere they want, whereas in the country they can't. There's only one place.
I was going to say, how many places could they go? Are there quite a few pharmacists in Karratha, or are you the one?
There's a few. There's 3, but it's actually all the same team across the 3. So it's under the 777 group, which is like a pharmacy franchise based out of WA. And so across those 3 stores, we're actually all one. So it's one big happy pharmacy family, which is really nice. I love that,
a pharmacy family.
Yeah. So
a bit more coverage.
And then it's so funny because you'll go to work, like you go to work one day in one pharmacy, you might have to quickly cover somebody's shift or lunch break or something in another pharmacy, so you hop over there, and then the next minute the patient that you talked to 15 minutes ago is coming over here and they're like, what? There's my pharmacist again. And they love it because they're like, I've just seen you. What's happening? So there's that component. And then I work in an Aboriginal Health Service as well. So there is a health service located 30 minutes out of Karratha in a local community called Roburn. And
is that role a separate role
a separate role.
To the role that you've got with...
But it's through that same pharmacy team again.
Right,
so we
okay.
sort of have a partnership
So they would have
with
the
them.
contract.
Yeah, correct. So we go out there, we provide pharmacy services from there, because essentially if you think about it, patients, they can go see any health professional that they want in that multidisciplinary clinic. But if there's no pharmacist or pharmacy there, then they would have to travel 30 minutes to Karratha just to get the meds, or they might go, there are a few neighbouring towns, about 15 minutes, but still that's quite a big drive. So when I say 15 minutes, we're talking 15 minutes at 110 kilometres an hour. So it's not...
From Karratha.
Or from Roebourne. So it's...
And not everybody would be driving.
No, correct.
Not everybody has access.
Not everybody has access to that.
How often do you go out there?
At this stage, I've just reduced down to once a week. But before that, I was twice a week. So, and I've been doing that role for, about 3, nearly 4 years now, because I also did that in my internship. And it's a very different type of pharmacy. So you're working on the ground as a pharmacist and you're helping with the provision of medicines for patients, but they've literally just come out of a GP consult and they'll walk straight to your window. You can see everything that's happening. So that's another thing, is in community pharmacy, the only information that you have is either what the patient tells you, what's on the script, what they've had previously, and maybe their My Health record if that is connected. But in this clinic, because it is all one, we have access to every other health professional's notes. We have access to all the blood results, absolutely everything that happens with that patient in that clinic we can also see, and that makes your job so much easier when it comes to like, we might actually, this might be a better medication that we could put them on, or like, what do you think about maybe continuing this course or reducing the length of this course, or should we look at a Webster pack now that we've got so many different medicines, all those sorts of things. Or if they come up asking, being like, when was the last time this patient had this medicine, can I start them on this dose now, or do we need to start low and go back up again? It makes it your job just so much easier, because you have that
visibility, but
picture.
also and the collaboration with the health professionals right there and there. That it can be a little bit more instant, I imagine.
Correct.
Problem solving rather than having to, I'll get back to you.
Yes, and then means that patients can get their medicine straight away, because you don't have to wait for a phone call to be brought back. Absolutely, that's definitely one of my favourite parts about my job, and again, very unique role. You've got lots of other health professionals there. It's not just nurses and GPs, it's physios, chronic disease team, paediatrics, and then you'll have visiting specialists. So it's really typically pharmacists work with specialists in a hospital ward if you get to go up onto the wards, but here you're a community pharmacist, but I get to work with them, which is pretty cool.
Experience, and what a nice combination as well to do with the community work as well.
Yes.
Did you always want to be a pharmacist? And
no.
Where did you grow up?
I was going to say, you mentioned boarding school there. Are you a rural girl at heart?
I am a rural girl, yes.
Where was home?
So home for me is in a little country town called Karratha. So it's in the Wheat Belt region. So for anybody that's not sure, if they've heard of Narrogin or York, Kellerberrin, Brookton, we're sort of centred around in there.
How big is that town?
That has... don't quote me on it because it could have changed, but when I was living there, it was about 1,000 people.
Wow.
So very small. So, going to school, there was 100 kids in the school. I graduated year 7 with 14 kids in my class. But I grew up there. My dad.
Did you love that?
I did love that. Yeah, I wouldn't change it for the world. I would do it again, exactly as it happened. I think that, I don't know, just that's probably also the sense of community and also your ability to socialise, because that's what everybody does. You're out in the middle of nowhere, so what do? Well, you all catch up with your friends, and all the parents get together, so then all the kids get together. It was really cool.
It's a genuine community.
And I loved growing up on a farm as well.
I was going to say, what did your family do to have that lifestyle?
So my dad's a 4th generation farmer, so it's been running in the family for a long time. But pharmacy is the closest to farming that I will get.
I didn't want to make the connection, but I mean,
just because everybody does, so I got to do it for you.
There you go. I
You're
totally
not the only one.
That.
No pressure to continue the farming?
No, not at all. My family were supportive in whatever I decided to do. I think. My dad absolutely loves being a farmer. I think he was partly relieved that I chose not to be a farmer, because it was also very hard work. It's pretty tough.
What farming is it?
Traditional wheat and sheep.
Right.
So, basically if it doesn't rain that year, that can be pretty scary. If it doesn't rain for multiple years, that's very scary.
Yeah.
So I think maybe underlyingly he was relieved that I chose not to do that, but I know he would have absolutely loved it as well if I chose farming. But it's all right because I have a younger sister, and like her and her partner are probably going to take over the farm. So,
was pharmacy always the plan? Like when, because you're so passionate about it, like did you do other things first?
Yeah, so I actually spent 10 years of pretty much my entire childhood wanting to be a ballet dancer. So I trained pretty intensely to do ballet dancing, like classical ballet with a company at some point.
In Perth?
Yes, well, I actually started out in the country.
Yeah.
So there was like a dance class in a neighbouring town. And it was like, I think it was my mum and a couple of her friends were like, oh, this is starting, like, should we just go there and we'll drop our kids there and see if they like it? And we went. And I remember watching the dance teacher being like, that's what I'm going to do. Like, that's what I want to be. I don't know why. I just like loved it. I was mesmerised by what she could do. So I was like, that's what I'm going to do. And so, spent quite a few years all the way through primary school dancing around, it was different country towns. So I danced not just Quairading, but I also went to classes in Cunderdin, Beverley and Tujay. So there was a lot of driving at one point.
Thank you, Mum.
Thank you, Mum. An angel. And then I had to decided to go to boarding school. That was what most kids did once you graduated primary school. The high school in my town only goes to year 10, so pretty much everybody goes. And I went to John Curtin, which is an art school based in Fremantle, so I went there for the ballet program as well. So pretty much, kept going right through high school.
And then didn't study though professionally?
No, so I did a lot with it. Like I got to travel Australia with it. At one point I went over to Austria and I got a chance to dance with a company when I was 15, which is amazing. But as I got older, it got to the point where it's like you either choose to stay in school or you leave school and you pursue this. It's just one of those things where you can't do both.
Yeah, you're in or you're out.
Yeah, in or out.
And then straight into pharmacy, do you think that was it straight in then or?
Well, once I decided to stay in school, I had no idea what I wanted to do, just like no clue. I was like, we're just going to roll with it. But I really liked science and I liked chemistry in particular. So I was that kid flicking through those university books like a week before you had to enter what you wanted to go into university, being like, I just need to find something and put something down.
And I'm good at chemistry.
I'm good at chemistry. Pharmacy has chemistry. I'm going to do that. And here I am today.
And so you didn't have
makes
any...
you feel better. I was flicking through that book for years.
Yeah. So you didn't have any inspiration or anyone that you knew to look to be like, I've seen the role of a pharmacist, that looks great. It was more just the science-based subjects.
Yeah.
Thought you'd have a look and see what it is and then just grew into it and realised you loved it.
Pretty much. So once I started studying, because also it, again, might have changed, the degrees changed quite a bit since I went, which was only 4 years ago, but it still makes me feel very old.
I'm like, where did you go?
But the first year is like a more general health science year. So you don't really get a good taste of what pharmacy is. So I did do first year and I was like, I might actually quit. Like, I don't know if I'm enjoying this because it's not...
That's so good though for a first year to hear, because there'd be a lot that would probably feel like that. Well, that's the thing.
We had, like, there was a lot of people that left in that year. Like our class pretty much halved in that first semester. Which some people probably definitely figured out, like, no, this is not for me. But also I think it's just, you're not really seeing what pharmacy is, but that's your impression of what it is, and it's a little bit vague. It's a little bit boring, to be honest.
Do you think something could be done there to really inspire those first year students? What do you think would have really gone, oh, yeah, this is it?
They need to bring in some more pharmacy-specific content into that first year so that they actually understand. Because the other thing that I think made a huge difference was I got a job in a pharmacy as soon as I started studying university, and it's not compulsory for us to work in pharmacy while you're studying, but that definitely
helps too, even just to connect you back to why you're doing it.
Correct. You also learn much easier, and you probably learn a lot quicker because you're exposed to so much and so you've seen a lot by the time you're actually learning it. You're like, I understand that process. because it's a very process-based profession because, you've got laws to abide to, you've also got, clinical thinking, and that sort of like ethical, legal balance as well between keeping patients safe, but then also what am I actually allowed to do. It's a very regulated environment. So, yeah.
What do you think about, do you see the role of the pharmacist evolving, particularly with the introduction of tech? Like I think about our local pharmacy where there's a vending machine, basically.
Yes.
It's like a competition to name it.
Yeah.
Like, what? I know, right?
I have seen these.
Yeah, like
they're awesome.
It's crazy, and it's what is the impact that things like tech like that is going to have on the actual role of a pharmacist? Will it shift? Have you seen a shift in the 4 years you're out?
In terms of how it impacts the role of the pharmacist, I think at the end of the day, it's always there to supplement or help us do our job better. It will never replace us because there are so many individual factors into why you make a decision for one specific patient that a robot is never going to be able to figure out. Yeah, because it can't have that like personal conversation, and it can't connect with people, and it's that barrier that you need to break. Quite often that impacts what you actually decide to do, but it definitely makes your job easier. So I've seen these vending machines. It's interesting, again, like a highly regulated environment, so you guys have got them, but I actually don't think they're allowed in WA. Based off WA laws on certain supply. Don't quote me on that, but I'm pretty sure I have heard somebody say that because I was, interested in like, why can't we? Like, why does nobody have one here?
Yeah.
But even in the pharmacy I'm working in, we've got these massive robots and we'll do like all our dispensing. We've got dispense techs that are brilliant and do that work for us, and it literally just shoots out all the medicines that you need. So you put the information in and it will give you the exact right drug that you need. Yeah. So that you don't have to.
So there's still a place for it.
Yeah,
yeah.
100%.
So it's similar to the automation pieces, and it's finding those efficiencies.
Yeah,
and
it's just
filling
making
some
the
of those
job
roles.
efficient.
Yeah,
and also reducing risk. So robots are proven to basically be more accurate in picking medicines than a human, because obviously human error doesn't get tired.
Well, tired was actually something I wanted to ask you, because it sounds like the role of a pharmacist is really, you got to be on all the time. You think about even a healthcare professional who is having breaks between consults, or not even breaks, but it kind of comes up and down. Whereas, we've gone to the pharmacy, everyone's waiting, no one's got time. It's like, how long's that going to be? How long should I come back tomorrow? What's going on? Yeah, and it's just go, script. And if you've got all of that critical thinking behind every decision that you have to make with every script that you're dispensing, I haven't really thought about it in that way of just the being on. Is it quite tiring?
It is tiring.
For a full shift? Yeah. Do you have to take breaks, and is there certain periods where you can be hyper-focused for that period and then you need to step away and come back? Or
it's something that's not like, that's probably what should happen. That's the point to make, because I was going to say that's, but it's healthcare and it doesn't stop. So there's always people. And you do just get days where it's one thing after the other, where it's just tricky, and we do try, like at least where I'm working, we do try to have the regular breaks. I think a lot of places are pretty good at making sure that pharmacists do have rest times, but there's also plenty of situations where that pharmacist will be the only pharmacist on, so they actually can't have a break. It's not allowed to be open unless they're
and
there
as a healthcare
watching.
Professional, you want to help, right?
Yeah, exactly. And there's times where it's like, if it is a dire situation, like I'm just going to go all hands in, like focus all in on that. And then sometimes, you deal with that situation, then you just have to turn around and be like, okay, we've got to go to the next one.
Is there a story or a moment, particularly in the rural settings, where you've been able to, it just sums up that impact that you can have?
I feel like that in relation to that go, but then getting the reward afterwards was definitely in my intern year when I was working up in the Kimberley. The WA opened their borders for the first time in 2 years. So it was very much a big awareness of COVID-19 might be coming back. Everybody needs to be vaccinated. There was mandatory vaccinations in WA to enter certain places, and people couldn't go to work if they weren't vaccinated. In those rural areas, rural WA, they were affected, but they definitely didn't get the impact of COVID-19. They went into a lockdown, not even a proper lockdown. It was like they were cut out from the city for 6 weeks, and then that was it. And then 2 years later, it was like, you must be vaccinated. You have to wear masks
because we're opening up.
Because we're opening up. Because they never had cases. They didn't. Well, not that they never had cases, but they didn't have many cases out there. It was always in Perth City. So it was very high pressure. There were a lot of people who were understandably quite upset. That's a pretty big lifestyle adjustment or something to be told that you have to do when you don't know much about it. And obviously, you know, with everything that goes on in the media and stuff, it can be pretty scary. So, yeah, it was definitely like one thing after the other, in the sense that you've got a lot of, it was pretty much just upset people coming through, like, I have to get my vaccine, but this is what I'm feeling like. I need my vaccine. I'm actually really stressed that it's coming back. It was a lot of conversations about wellbeing and mental health, which I was so happy to have those conversations with, and I think a lot of patients found them really beneficial. But obviously you do that one after the other, and then you know that you've got a million things going on in the background in the actual pharmacy. Like, obviously vaccinating is just one part of the job. But, you know, it was really rewarding in the sense that a lot of them turned around or came back if they needed, especially if they needed another vaccine, being like, I've just felt so much better after being able to talk to you. Like, thank you so much. Yeah. You just got to let people say their piece, you know, like sometimes we know what we know as health professionals, but what we know is not always information that's helpful for them in that situation. So really just letting them say what they feel and being like, yeah, okay, fair enough that you feel like that. Like, I can't argue with that. And then being like, these are your options today. Like, what would you like to do? But yeah, it was pretty intense.
I can imagine. Do you feel that, like, hearing some of the stories that you've spoken about today and going into those communities as an early career pharmacist, it sounds like you're in a really nice collaborative team. I imagine some of the rural placements might not have the level of support that you do. Yeah. Do you feel that as an, you know, quite early in your career, you've been able to upskill more than you would if you'd taken a more metro
100%
role?
Yeah.
And I guess do people need to be a bit mindful of where they go to make sure that they have that support?
Yeah, I definitely always recommend doing as much research as you can, and that can be a little bit hard because I do find that rural pharmacy jobs, even though there's a lot of them, they're not necessarily advertised like they would be in the city because they just, again, don't have the capacity, or they might not have the time to actually make an advert. So to be honest, all of the jobs that I've gotten rurally, I've actually just called up the pharmacy owner being like, are you looking for anybody? Because I'm interested.
But you have to know where the locations are to
you
do
have to
that,
know
because some people don't know.
And were you heading to Karratha? Like, was that
what drove you there?
Oh, yeah, no, that wasn't a plan. That was actually my last placement. Right. So I'd already taken the job in Broome for the following year, and then I decided to do my very last placement in Karratha because I knew that I wanted to do a rural placement because I'd done all the other, like I'd done hospital, I'd done community. There were a few other opportunities, like you could go into like mental health facilities or pharmacists that worked with aged care facilities and stuff. But I was more interested in, like, honestly, I was like, I'm happy to go anywhere. And also, like, Karratha's got Karratha, you know, which is a beautiful gorge where you can go out there. Karratha's also close to Exmouth and Coral Bay. It's excellent snorkeling. Like, why wouldn't I do that if, you know, my university is going to send me there? And then, obviously got there and I was like, this is amazing. So sorry, I've lost track.
You loved it. No, you were saying like you got the best opportunities by going out to these remote areas and more rural. You get more experience.
Yes, I think that's what you're saying. Like the support of being in different areas,
an ability to upskill.
So in terms of support, the easiest way to do that is obviously going out sooner rather than later. You're being a student is the perfect time. There is a big conversation around placement poverty, which totally understand, and that's
what
very
does that
applicable.
mean for someone listening? They're like, what?
So
the students have
so a lot of healthcare students, when they go on prac, they'll go on prac for quite extended periods of time. So the longest prac that I went on was 5 weeks. That's actually considered quite short in the healthcare sector. There's lots of other health professions, they'll go for 10 weeks.
Yeah, I was an occupational therapist. We went for that long. I'm like 4 weeks.
Yeah, we'll go for months. And then there's some like medicine, they'll go for a whole year, and that's totally unpaid. Obviously, with the rising cost of living, that's extremely difficult.
How are people doing it?
That's a good question, because it wasn't, the inflation that we have now wasn't as extreme.
I used to work on weekends, I remember, but I was thinking, like, if you went out remote, like, I'd work so many other shifts around it, but then if you were in a remote...
Well, that's the thing, if you're in a remote area, you can't just go and get a job because you don't live there. So I think there's hopefully a lot of change, and there's a lot of advocacy around that space, because it also depends, like, the university I went to, they fund you to go to rural areas. Not all universities do that. It has to be self-funded, which is a real shame, because it's like, why would we not utilise everything that we can to try get young people into rural areas, because we know that if you go there as a student, they're more likely to return. And
most people, at least with placements, you get there on a placement, they fall in love with the area, the locals, they'll go back there.
Yeah, and it's like, the universities are essentially the leaders in in shaping our profession in the health sector. We have that responsibility of making sure that people in rural areas get the same level of care. So that's a real shame that happens as well. It can be really tricky for people to go on rural pracs. So even though I say you should go sooner rather than later, at this stage it's if you have the capability to do so. Which is a real shame.
Talk to me about your social media work, like your TikTok account, your Instagram account. Like, it's so beautiful, the content you're creating.
Thanks.
What impact has that had?
I mean, it's been pretty incredible, really. It gives me a lot of fulfillment, which is why I continue doing it.
What is it that's fulfilling for you?
It's the people that get in contact with me, and everybody that's like, it's just had a lot of positive, it's been received really positively.
From pharmacists?
From pharmacists, just from people in the general public, people in other health professions. And I think it's because it's really highlighting, we talk about, going into rural healthcare, but again, if you don't see what it actually looks like, saying something at a university lecture on a piece of paper is very different to actually seeing what it looks like. The other aspect is you can go be a rural healthcare professional, but the other side of that is you need to know what it's like living there. Like, you have to be able to live there.
You can't Google these things.
You can't Google those things. No, especially in rural Australia. Like, obviously the tourism is not as huge as somewhere like Europe. So it can be tricky for them to find out that information, and a lot of it on Google is outdated. So you look at it and you go, that just looks like red dirt, when there's actually now big buildings and houses there.
Do you think a lot of the rural community roles or clinics are as beautiful as the one that you're working with? It
is stunning.
It looks beautiful. I think you posted something about, the most beautiful pharmacy out there.
Oh, yes,
Is that rare?
I mean, the one that I'm in at the most, that definitely has to be one of the best.
It looks
that
brand
I've
new.
seen.
We have had guests, haven't we, from hospitals in outback towns, and people assume that it might be outdated and dusty and all these things, and they've got brand new facilities.
Yes.
And it's actually
Well, that's the same actually in Karratha. They've got a pretty brand new hospital, and same in South Headland. Their hospital is a little bit older, but I think it's only 10 years old or 15 years old. So the facility is actually really, really good. Yeah. It's definitely your small towns. So like where I grew up, 1,000 people, it's the same hospital that's been there for a long time. So they are, and they're tiny, nothing's changed. Yeah. But then, you do get the opposite, where you've got these big major centres in these very remote places, and they have really good facilities. And we do get a lot of comments from people who travel through Karratha. We get a lot of tourists coming through because they pass through up to Broome, or they want to check out Carnarvon, Exmouth, all of that. And they come in saying that the pharmacy that they've just come into in Karratha is the prettiest that they've ever seen. Which is pretty incredible. But that also goes to show, like, it's not just, it's not that stereotype of it is like a little tin shed that you're working out of.
Did I see they're up for an award?
Yes. So the team that I work with, so it's Pharmacy Help Karratha, which is under the 777 group. They are up for Pharmacy of the Year, which is pretty much, like the biggest award that a pharmacy team. I'm very proud.
And is that it? Because you're here for the pharmacy conference.
Yes.
So is the awards part of this conference?
Correct. Mm-hmm. So we find out tomorrow how we go. But to be honest, like, we're just so excited that we've made it this far. I think it's great to get that rural representation out there that, like, they're assessing, the calibre that you work to, what you provide to the community, and also, like, the team itself. Well, you can get those award-winning teams in rural places. Actually, I will plug this because, again, very proud of it. I'm very proud of all the people that I work with. So just in Karratha alone, we're up for Pharmacy of the Year, but we also have, one of our bosses, she's just won a federal award for as a Medicare champion, so celebrating 40 years of Medicare. We have 2023 Intern Pharmacist of the Year, 2022 Intern Pharmacist of the Year. We've got WA Pharmacy Assistant of the Year, a finalist for Pharmacy Assistant of the Year. We've got a lot, there's more. Honestly, could go on.
Early career.
Yes, so. I've got Intern Pharmacist of the Year 2022, which is old news.
I'm sure that you did that. You didn't mention yourself there. You mentioned we won. I was like, wasn't that you?
But also very excitingly, on Saturday, I've a finalist in the Young Health Professional of the Year for WA. So on Saturday I'll find out how we go in that. But again, just very happy to be there.
Just being a finalist, it's just fabulous. Yeah.
And again, just there for the pharmacists, like we've got a pharmacist in there, so that's the main thing.
That's amazing. Yeah. And do you think that your social media is really helping build the profile of pharmacy? And is that the intention? So. What do you hope to achieve, and what's the impact you'd like to leave?
The main thing that I'm trying to get out of it is to just get more young pharmacists interested and have the knowledge about rural pharmacy, and having it in the back of their mind. Once we get their interest, they might be a little bit more inclined to give it a go. Once we give it a go, we often find that a lot of them will end up staying. But even just if you're only there for a week, a couple of weeks, months, whatever, any time that you can spend is a contribution to that community and to the people that you work with. So it's about building workforce, getting people out there, because they won't go out there if they don't know what to expect.
How would you sum up, if you could give one bit of advice to a graduate about why they need to go out to these rural roles, like, what would you say to them?
You can do anything in pharmacy, but it's much easier to do absolutely anything in rural pharmacy. You can go anywhere.
Yeah. Love that.
Yeah.
Love that. Yeah. So with this episode, CMR are going to be donating to a charity of your choice.
Yes.
Who can we talk about today?
I think it would be wonderful if the donation went to the Pharmacists Support Service. So that is a non-for-profit volunteer service run by pharmacists, and it's essentially a phone call line that pharmacists can call if they are needing support, or just needing somebody to talk to, whatever that may be, particularly after high pressure situations is probably a very good example. Somebody that's removed from the immediate situation, but they're a pharmacist themselves, so they can understand exactly what's happening, and they do that service 365 days a year, so that pharmacists have somebody to talk to if they need to talk to somebody. I have called that line myself, and I think what they do is wonderful, so I would love for that to go to them.
What a great
fantastic
cause.
Great
That's
to raise awareness.
Yeah.
I was just going to say that, like, how good you want to raise awareness for organisations like that, and obviously a need, and particularly for your remote pharmacists as well. You're a rural pharmacist, you want to have that number.
Yeah, exactly, because they might not have anybody there immediately
in a small town.
to turn to. Yeah.
Oh my goodness. Shay, thank you.
No, thank you.
It's
this has been wonderful.
Lovely. Like, I think there is so much to learn about pharmacy. Like, it is so interesting.
There's a lot to it.
There's so much intricacy, but I think just the way that you speak about working rurally and just your passion for what you're doing. And And, you know, for anyone listening, like, please follow Shay, the Rural Pharmacist, on her social media, on Instagram and TikTok, like the stories, the tidbits, little info. It's just beautiful. Like, it's a walking advertisement for the profession. And you bring so much light to that. And I think the future ahead of you is incredible. I can't wait to see.
I'm looking forward to the future. And I think that's the exciting thing is, like, the future, there's never really been a better time to be a pharmacist because there's so much changing. That's the best time to get in there and, you know, build a career for yourself and do whatever you want to do. And, I am excited about the future of pharmacy. So,
Watch this space when the episode drops. Absolutely. Hopefully you've won an award as well.
Hopefully we'll see.
Have to update it. Fingers crossed. Thanks, Shay.
Thank you so much.
Thanks for tuning into It Takes Heart. If you love this episode, subscribe, leave a review, or share it with a friend. And if you know someone with a great story in healthcare, get in touch. Follow us on socials for all the behind-the-scenes fun, and we'll see you next time.